Welcome all to the MLDMHI podcast on a Sunday morning. All that who have joined, I really appreciate your energy and enthusiasm for spending time to learn something new today, which is going to be child psychiatry and homeopathy from a person who is a subject expert in this field. This session today is going to be all about child psychiatry and homeopathy. This is the first time probably when we are going to talk on a live session about this particular topic, and I'm glad that we have a subject expert to share her expertise with us on this topic today. I would like to introduce Dr. Swapna. She is the founder director of IRA Gurukul, which is a multidisciplinary center and NIO school in Mumbai, Thane and Palava. She works with children who have got autism, learning difficulties, developmental disorders and other behavioral difficulties, and she's been doing this since the last 15 years. Also, she is the prestigious alumni of MLDMHI. She has done her MD in homeopathic psychiatry from the College of MLDMHI. And so, Dr. Swapna, I would like to begin with our first question today. I believe we have a mixed audience today. We have got homeopaths and we have also got people who are not homeopaths. Okay, so why did you pursue child psychiatry and why the College of MLDMHI?
Okay, so good morning all. Again, welcome to our podcast. And I'm here to share my journey and personal experience over the last 15 years. So, this question goes way back in 2005. I think the amount of understanding we then, maybe at 24, 25, was not that developed, okay? And not the exposure of what I see. Teens and children today are way matured. They have their goals. They know what they want to do. It was not there, and nor did we have the drive of, that I can make a difference in the community. I need to go out there and what is mental health orientation? No, there was nothing like that. I think the quest was to get knowledge, and the quest was to find mentors in the field who could guide you to achieve. Probably that was the only understanding that I had when I completed my BHMS. I was also interning with a very famous pediatrician in Mumbai at that point in time, and I had joined ICR. So the whole idea was that I had joined ICR, Institute of Clinical Research, Mumbai, to get more knowledge so that my skills could be enhanced. We, a set of few students, were posted then in 2004, 2005 at MLDMHI Palghar for our ICR posting. So we were, in fact, the first batch of students who really got that opportunity as an ICR student to go to Palghar and be as an ICR student. I think that gave a twist to the whole story, where what is an OPD posting, what is an IPD posting, using homeopathy in emergency and clinical medicine. That is something we had not seen. Casualty, treating patients with homeopathy, what is rural posting, what is community services, how an interdisciplinary approach, like we had our orthopedic surgeons, we had the medicine doctors, we had our surgeons, gynecologists, and how they would give the case to us to say, okay, now you can start your homeopathic treatment, or we are not able to pursue and now you can, intervene. So that world literally gave us, showed us a world beyond what we had done in our BHMS. And that quest was developed that if I have to do something in my life further, I would do MD from MLDMHI. So the subject orientation was already not there. It was more to pursue MD from MLDMHI. So even to take a decision then that I'll give 3 years of my life to studies and education was quite, important. And there the journey began, because ours was the first batch to do CET. CET was not, started till then. So then we used to sit in Palghar, we used to sit in our hospitals, do our duties, study for MD, and with the orientation that, okay, I'm going to come here next soon. So this is how the entire journey started. Obviously, when the results were declared, I wanted to get into clinical subjects. And by God's grace, it was possible, and we could pursue psychiatry. I could pursue psychiatry. So this is how the entire journey started. It was definitely not about the subject. I think it was about getting to the right place. Once you are at the right place, you just get going. So I think that is how it started.
Right. And madam, why particularly the subject of child psychiatry?
Okay. That's a very interesting field. That's a very thing, because let me take you to the journey of psychiatry, in fact, at MLDMHI when we were in 2005, because the organization or the institute, we were at quite a nascent age. The current, the way we have the systematic protocols or the Anukampa ward, the psychiatric unit, we weren't, there was nothing such like that. We, as students in the Department of Psychiatry, we had a quest. We used to go around in the wards to identify, okay, this file, this parent, this child is, or this student or this patient is clinically nil of all physical disorders. This case is going to be transferred to psychiatry. So we always had a quest of finding cases. It never walked into us. It was never given to us on a platter. We had to really fight through cases from OPDs, from IPDs. Okay, now please refer them to psychiatric unit. You all have worked enough. Nothing is happening. This is somatoform. This is anxiety disorder. Please send it to us. So this is how the journey began of an enthusiasm-built team, where we were just, finding our way out. And that is how the psychiatry thing began. We had our seniors who were doing MD, our mentors were doing MD with us. So again, never anything was taught. We had to observe everything. We had to learn through, seeing how things have been done. And that is how the whole quest for knowledge began. How child psychiatry came in is specifically, like if in MLDMHI in Pagar, we have community medicine. And we go to padas, we go to, rural places, and we work. But I think it was the first time, I guess in 2006 or 7 around, where our HOD introduced school health project. We call it as SHP, where community medicine, taking community medicine to, with respect to mental health, was the first time it was, introduced. So we were given the opportunity to go out to spread awareness in the community, in the population, which was definitely not initiated before at MLDMHI. So with this began our community drives, going to schools, meeting people, trying to create awareness, trying to create, parent workshops, student workshops, teachers workshop, and trying to build about community awareness with respect to mental health in children. So that was the first thing where the school health project was taken up, and the seniors, juniors, and us from the Department of Psychiatry, along with our HODs and mentors, would go out every single day to, try to bring, what we can do. So, and from there, we started a journey of creating case studies. We started creating our questionnaires. We started intervening. We did research. So, a lot of things, because now that I'm working with school children, now that I'm working as counselor, and if I look back retrospectively, how important is a school for setting a foundation for child development? The entire ability of a child, be social emotional development, cognitive development, behavior, everything is laid back in the school. And your intervention at that, it's a tricot system. The parent, the teachers, the mental health professionals, you can really do mentors. Our campaign then helped me and us to understand what really you can create a difference in the community. From there, from the workshops and awareness drives, we went to identifying population which needed mental health support. We sat with the research department. We created checklists. We implement the checklist. We used to have cross-sectional studies. We used to have one population who was treated with medicines, one population who was intervened in another way. So this is how the entire journey started of school mental health project. And I was lucky enough to carry it ahead even when I was a medical officer. When post I completed my MD. So we carried on this entire thing for a good 4 or 5 years. So that was one experience, that was one great learning, which I couldn't leave behind, because we all invested a lot of time, emotions, effort, and a learning. So that was something which I had to carry forward, and the second thing which really took place then was, again, thesis. Thesis is a very, very important part for students. So I will definitely say that think when you are selecting your thesis. It was very, very easy for us to pick up, an anxiety or a depression and find a role of one medicines and do a thesis. But no, sir had a conviction maybe in us where he wanted us to do research, and again with respect to school mental health. So I remember my seniors telling us that, are you mad? You're jumping into the well. Why are you even doing it? It's not a cup of anybody's tea. You can't go and do research. Many things then. But yes, I would like to share my topic. So I had this something which is very different. My colleague took about children, and the topic which I took up was evaluating teachers' awareness in mental health conditions in a semi-rural population for enhancing their skills and abilities. So this meant to work with a set of teachers, evaluating what is their role, what is their contribution. We did qualitative analysis, we did quantitative studies. It was a longitudinal period. So yes, we had the population, because in school the children are across, right? So the teachers are also across a period of time. So yes, we could do these studies. We got the opportunity to go to TISS and understand what is research and implement it in our thesis. So from there, child psychiatry really started, and I think I've been really blessed. It's been more than 15 to 18 years that I'm just focusing on the same field and taking it ahead. So this has been the story behind child psychiatry.
Wow, so you not only build a solid foundation, understanding the basic subjects of medicine, surgery, you also jumped into the well and also found out what was at the bottom of the well. And you brought it out for all of us. Fantastic.
Yes.
For homeopaths who are listening to this, who are interested in the subject, you can now understand what the depth at which Dr. Swapna has worked. And not just that, she's still doing that right now. So quite inspiring. To the next question, this is going to be a little academic question. Dr. Samuel Hahnemann has laid down guidelines for diagnosis, treatment, and assessment of follow-up in a particular case. Are there any specific guidelines in the organon for treatment of psychiatric, neuropsychiatric diseases in children?
Okay. Okay, so if I have to just make your question simple, we try to understand what Dr. Samuel Hahnemann has laid the foundation vis-a-vis what we are doing currently, right? So, Dr. Kate, to be very clear that if we talk about first what was mental health, the concept of mental health then and the concept of mental health now. So anybody with mental health difficulties way back in the 17th and 18th century, long to 50 years back, were lunatics, or they were, maniacs. And the treatment methodology was, chaining them, putting them in asylum. So mental health is something which was treated with asylum care. And I think Dr. Samuel Hahnemann has been the pioneer with respect to mental health. If we go back and read literature where everything that when we all know that he's given us with again on the mental health, you have the aphorisms from 210 to 230. But let me tell you what he has actually comprised. What are these aphorisms about? They are absolutely about so he's combined with the role of medications, the medicine cure. He's combined theology, he's combined psychology, he has combined, physiology. He's combined all these things to put up in those aphorisms and giving us the idea about what is the need of mental health awareness, how we need to take it ahead. So we have a pioneer who has already set the things way back then. What we currently, or what that time Dr. Hahnemann mentioned about mental state and disposition, now we have a very structured categorization. It is more into symptomatology, and it is categorized, into diseases and disorders. And, with our DSM and ICD-10, the diagnostic criteria has become easier. We have codes for specific diseases. So obviously we do not term them, but we have the codes. So when we read the codes, we are aware what is the disorder that we are trying to implement. And this helps in easy therapeutic interventions to plan out medicinal and non-medicinal cure, the treatment modality. So this is how I think the journey has been done from then to what is now. Also with respect to what we now do, a lot of, allied treatment for kids or for patients with respect to psychotherapy, with respect to counseling, with respect to CBT, REBT, hypnosis, regression. All this, if you see again back then, Dr. Samuel Hahnemann's approach was also there. He has mentioned how you need to take care, with benevolent talks, do not chain up the manics. He's also spoken about how the treatment should take place along with the medicine. So he's also mentioned to us then, where he has given us the use of allied therapeutic modes, which we now clinically term as, maybe counseling techniques and psychotherapy along with patients. So I would say, yes, the journey has been since then. And now we are carrying it forward with respect to a structured categorization of symptomatology and disorders which are present. So it helps us in diagnosis as well as in planning therapeutic intervention. So yeah, that is with respect to what we are doing currently.
Right. Uh, the next question now would be how useful is it, especially in the clinical assessment tools, using them with homeopathy,
Okay.
or understanding and interpreting those tools? What does a homeopath need to know about these things?
Okay. That is again a very, very interesting question. That why would me being a homeopath, or why would me being any doctor, why would I need to know an assessment tool, or why do I need to interpret an assessment? See, Dr. K, when you get a patient, or be it medicine or mental health cases, you definitely, they come up with reports, right? And yeah, you can read the reports, and you can read the findings or the conclusion and the impression, and you can treat. So, I mean, you can say that, yeah, this is so and so. This is a slight, there is a slight difference between cases where we have psychological assessments and when we have medical reports. So you can read your hemoglobin report and you know this patient is anemic, and you can start your treatment. This does not happen exactly in the same way when you are interpreting psychological reports or reports which are given developmental scales or anything else. There is a difference. There is a vast difference. So I would like to share this with examples where I have in fact met so many patients where this doctor has said that no, आपके बच्चे को कोई difficulty नहीं है, ये learning difficulty नहीं है, IQ normal है, तो क्या है? This is not a case of LD. Or this is autism. They've directly seen 2-3 symptoms and said this is autism. या scale पढ़ के बोल दिया. No, it does not work that way. If there is a child, if there is a report that comes to you, we do not just read the impression. We go through the entire understanding of the test which has been conducted. I like to share it with an example. Like, we know that the average IQ of a child is between 90 to 110. So if my scale is around 95, which is a global IQ, I will not say that this child does not have a learning difficulty. We go through the next parameters of what is the verbal scale, what is the performance scale, is there an interscatter difference? If the difference is there, how much is the difference? And then we work about, okay, no, why is this child having a learning difficulty? So whether there is a difficulty at the stage. So if I have to plan intervention, I will not just sit, okay, I'm treating LD. It will not end up by me giving medications to the child for treating LD and say that, oh, now LD has been, learning difficulty has been cured. I will need to understand where is the difficulty of that child. Whether it is, when we go through the report, whether it is on verbal reasoning, whether it is on verbal comprehension, whether it is an error in perception, whether it is a general fund of knowledge which is difficult. So we have to get, then I know whom do I have to refer the case to. So maybe I need to call my occupational therapist to work on the auditory perception skills to first develop that. Then I'll ask my special educator to take only verbal comprehension, verbal skills development, so that I bring the scale up. So when my verbal and performance scales are on a balance, and then I am intervening there maybe to facilitate the process, or maybe for attention or for hyperactivity, as a team, I think we can then, or as a trio, we can then work towards curing or helping the child doing better. So reading the reports is one, interpreting them is two, and then planning a structured therapeutic intervention is the third part. So just by seeing your impression or your conclusion, prescribing will not help. That is the reason why either there are dropouts, or there is no cure, or there is no, all the cases are not successfully treated. So this was just one example. This is also applicable to most of the developmental checklists, developmental scales with respect to personality behavior, maybe aptitude. So we cannot just read the impression and conclude. You really need to know what area has to be treated, managed, and intervened, so that you can facilitate cure, or you can facilitate the process to become easier. So yes, be it homeopaths, be it doctors from any field, so you need to have a knowledge definitely about understanding these psychological assessments, these tools, which tool to be advised to, because we have cases where they just send for evaluations, or they just send for speech therapy. Maybe that is not the stage that is required. So yes, knowledge about all this is very, very important, and only once you are skilled at this stage, I think you are able to prescribe or allow assessments. Do not prescribe assessments until and unless you are very sure what is needed for the child. So knowing them as well as when to prescribe them are equally important.
Right. So So dear audience, now I believe we all must be understanding why this is a super specialty within psychiatry, within homeopathy. It is not just that we prescribe, the patient gets better. There is a definite assessment, there is a definite prognosis, there is a definite way of beginning the treatment. We don't just pop the pill.
Yes.
Okay, great. So over to the next question. Homeopathic psychiatry is a specialty. However, if a homeopath who doesn't specialize in this subject but wishes to take up, and especially the subject of child psychiatry, where can one start and what does one need to know about this subject?
Okay. You need to get back to the school. You need to really pack your bags and go back because yes, I believe that because yes, it is a lot of understanding of the entire subjects. I don't feel we can really do justice with the 3 6 months or a year course because OPD, understanding patient at the IPD level, understanding patient at the emergency level, understanding what is your role at different stages, understanding interdisciplinary approach, what are the other mental health professionals that come into role, what is your role along with them. It needs a detailed understanding. It needs a detailed study. So just by reading maybe a psychiatric book or a DSM and knowing a homeopathy and you try to combine, I don't think it will, you will get a satisfaction. Beyond a time, it is just like a trial and error. Think this was managed and this was not managed. So yes, this needs an entire study because I will like to share my personal experience, Dr. Kayur, that when we have studied for DSM, DSM-TR, and now, post last 2 years, maybe after the pandemic, we are seeing a total lot of new cases which were not even mentioned before. Every day in the schools where I worked or in my OPD, we get a different multiple things. So currently, we are not dealing more with autism. DSM-5 has come up with a new diagnosis of social communication disorder, and we are only which is a disorder for pragmatics. And currently, we are only seeing children from 1.9 to 2.3, 2.4 having delayed communication skills. And I have people who've come from other doctors, kisko autism hai. No, they are not children with autism. They mimic or they look like autism, but this is just they don't show any other traits of autism, but it is only a social communication disorder. We have a lot of internet coming up with the kids, and there are so many new disorders which have come up, which have gambling addiction, we have internet addiction, mobile addiction, and we are currently actually treating them as disorders which was not there before. I have so many cases of MD, so where there is a dysmorphic mood, and it looks like an oppositional defiance and ODD, but it has intermittent outbursts. So we are treating those cases with new disorders and terminologies. There are exfoliation disorders. So the way we have trichotillomania, we have skin picking disorders. So there are these new cases which are actually being seen in practice, and they have come in DSM-5. So we need because evolution with psychiatry, what is human mind is evolving. So the moment the mind evolves, your psychiatry is going to evolve. New things are going to come up. So I think a constant abridge, or even if we devise a course or a curriculum, there has to be an update very frequently, because as things are evolving in mankind, in human mankind, things are going to change, things are going to evolve. So yes, I don't know how easy it is, but definitely for students who would like to pursue MD, I think they should go for it, because it gives you quite a structured background with adequate exposure with respect to clinical medicine, with respect to homeopathy, IPD, OPD, community service. So yes, I think that should be something which a person should look forward to.
Right. So basically, it is all the way from the school to the community where you practice. So yeah, that's good. That sounds quite a lot, but probably that is what is needed if you want to really make a difference in the life of a child who has been suffering, and not just that child, probably the family as well.
Correct. Because especially for children, Dr. K, we do not touch the child. We are actually, it takes a village to raise a child. You are intervening with 100 people, the parent, the educators, the school, the grandparents, the family. It does not restrict. Imagine if you have to break a diagnosis, or you have to tell somebody that no, your child is having this mental disorder, is not easy at any age. So you do not work in accord. The amount of sensitivity and the sensibility is required. It does not end up with just giving a diagnosis and cure. It goes way and beyond for them to understand, accept, and then come back to you to follow a protocol or a treatment. So this cannot be just, developed with a six. I mean, I've been very honest. This cannot be just developed with a course or something that comes up. You really need to intervene at many levels to get to the core of helping a resolution, or to get out help, or to make somebody's life better. So yes, I think that needs to be done with a lot of vigorous effort, and seeing that many patients, which I think a structured program like an MD can is useful or will be beneficial for students to go ahead. So I would definitely recommend students across, if they are watching this, that yes, if you are very clear what you want to do, I think an MD should be something which should be, you all should look forward to.
Right. So basically, your learning only continues when you are even on the hot seat. Like you said, breaking the diagnosis, as simple as it sounds, it could be devastating for people. So when you are in the hot seat, probably the learning only continues and you have to keep evolving. Okay, great. So madam, over to the next question. How useful can a setup like the one you are having be for a homeopath, and how does it help, a regular practice versus this kind of specialized setup?
Yes. So Dr. K, there are two things to it. I mean, maybe everybody will not get, because coming from a metropolitan city, it becomes very easier for us to have an interdisciplinary approach, and where we have professionals of different backgrounds working together. I wouldn't know how easy it is back there, but though mental health awareness is rising, and definitely there are, there are people who are available. But when I started my practice, because I was already having a good background about what it was, I actually began with an interdisciplinary team and a child development center. It was never like an OPD practice to begin with, because the learning was good enough to know what I have to implement, and especially Mumbai being a place where these facilities can be easily availed, we began with an interdisciplinary approach where I combined all the professionals together and started a child development center. This helped, where and again, this lesson which I got in when I was doing school health project, that parents were hesitant to come towards a psychiatrist. And the moment you say that you are a psychiatrist or a doctor in school, they are quite reluctant. They are quite like, no, my child doesn't have a problem. So an approach from counseling was important. So that helped me to immediately take my degree in counseling, do psychotherapy and counseling, take a master's degree. Because with that approach, when you approach a child or a school, the parents are at least calm. They are more willing, and they are open to see you. And then once they develop a bond or rapport with you, they are able to take you as anybody. I mean, that really doesn't matter. So that was also something which I did immediately after I finished my MD. Now, coming back to your question with respect to an OPD practice and with respect to when you have an integrated setup, what can be the benefits? So now, even after so many years, I will tell you how patient care has changed. So currently, when I sit for case taking, or when I have to take, we have this helicopter parenting, and we get no information about the child, because the child eats what the parent has decided. The child eats when the parent has decided. There are no specific, whatever the parent does. इतने बजे उठना है, इतने बजे यहाँ जाना है, जमीन पे पैर रखते ही नहीं है, उसके मेड रहती है, पानी का ग्लास भी. So the child has no skills. There are no cravings. There are no aversions. There is whatever anger. They tell you what they want to hear about their child. So you barely get any information from, I mean, this is what is currently, which I've been observing of recently. Even in neurodevelopmental cases, it becomes very difficult to get the adequate history. Now, how this setup helps us is that when the child comes in for therapy, walks in for play therapy, group therapy, or an occupational therapy or speech therapy sessions, over a period of time, you really set your observation skills. So we are there with the child throughout for an hour over successive periods of time. And that gives you a clear understanding of what the child is as whole versus what background you get from the parents, or the information that they provide you, what they want you to know. So they restrict the information. No, बिल्कुल hyperactive नहीं है, कभी कभार यहाँ वहाँ चढ़ लेता है. So this is the history. And even in that 45 minutes or 1 hour of case taking in a restricted space, you cannot really observe the child with that thing. But when you have kept the child open in maybe in a ball pool, or when the child is free to play, you really understand what are the level of social skills, what are the communication skills. So this helps. I mean, like what Dr. Hanimal says, an unprejudiced observer. I have been prescribing off lately only on my observation skills and what I observe with the child in a setting versus what actually we get an input from the parents. It is only and only over a period of time they come up with the actual thing about the child, or the child then starts, once the development has taken place, then you get specific parameters that you are looking in the case. So yes, this definitely helps. Again, what important thing that I would like to share is that this helps you to collaborate. You come to know the progress of the child, because since we work as a child development center, what is the child doing in school? So the school counselors are in touch with us. So not just the 8 hours or 6 hours after school where the child is packed doing A, B, C, D, E, F, G. There is no space. There is absolutely no space. But when the child is in school and what the child is doing, so we are again in sync with the with the school counselors, where we get a good understanding about what is actually happening in that environment. So this really helps for as I say, for not just prescription, but it also helps to give proper structured therapeutic intervention or modalities for treatment in such cases. So it is definitely a win-win if you are able to either set up or be a part. Maybe you're not able to set up, but if you have any CDCs around and if you can go there as a consultant or be a part of it, that could definitely help you to do justice to your work. So that is how it has helped me, and this is my personal experience.
Quite inspiring, and I would now, I'm keen to understand what is exactly your setup like. I'm sure a lot of homeopathic psychiatrists who have done their MD in homeopathic psychiatry would be attending today and maybe seeing this thing later also. What is your setup like? How is your team? I mean, I know it's a question which requires a long duration to answer, but still, if you could share with us, because there are parents who might also watch this podcast. So, what is it like? What should a parent look forward to?
Okay, so one important thing that the parents, and this is again my learning, which I have picked up from MLDMHI, that when we work, we all work as a team. We don't work as solitary. Like I am doing something, I'm prescribing, my occupational therapist is doing something, then the parent picks up the child, goes to a speech therapist at XYZ area, then the child is going to school. The school and the school counselors are working on whoever are watching this, please need to know that we all need to join our dots and work together. Be it in whichever part, you may not have this system, but you need to make an effort to make a call and find out then what is happening, or collaborate, or have a touch with the therapist there, which are the areas. Because now that we are in school, I can tell you that whatever the child does in a one-on-one and a closed setting is vis-a-vis very different in a multi-sensory environment with 25 kids with no inhibitions around. The problems that they face in school is very different. But when their child is at therapy or at home, it is very structured, it's streamlined, and there is no breathing space. So you will not have those symptoms out here. The next morning when the child goes to school, the entire picture is different. So yes, you need to make effort to collaborate. You need to make effort to step out of your zone and not keep yourself in the box if you are looking for this field. And you need to make connections, mail them, constantly in touch with them, review your follow-ups through them, but not through the parent information, because either they are busy working or their structure is so fixed that there is no space for the child to do anything. So yes, then that is what as homeopaths or as doctors you need to do. Coming back, what is our setup? It is just an integrated interdisciplinary setup. When I use the word interdisciplinary and multidisciplinary is very different. Interdisciplinary setup, we all are working in a team under one roof. And there will be speech therapists, physiotherapists, occupational therapists, psychologists, counselors, educators, we all are available under one roof. So even if the child is not with another therapist, or if there is a child who's going for occupational therapy, but if a special educator finds something with respect to academics, does intervene or gives tips to the parents how they can work upon, or if the child, so there is a good collaboration, there is a good link. There, every child is monitored by 6 different professionals all the time. So what happens is that the duration of the entire thing becomes shorter, it becomes quicker, and it leads to good rehabilitation. What we are actually trying to do, we are not trying to treat or cure. You cannot cure an autism. You cannot say I cured LD. No, we are trying to rehabilitate the person with respect to the challenges. Like from grade 5, the child will go to grade 6. Now the challenges are going to be different. From 7th, the child is going to go to 8th. The challenges are going to be different. So we are then developing rehabilitation for the child, how he is going to cope up. So these integrated or these interdisciplinary setups help in very smooth facilitation of the entire process. You are able to know when to refer the child for testing. You are able to know when to refer the child for any other evaluation. What is the role of medications? When do the role of medications come in? So this definitely helps the parents, helps the child And it is a very coming up I would say things, and people should start working in or think in that direction. The moment you're thinking in that, we thought about it 15 years ago, so I'm sure now it is more easier and effective now. So yes, if you are even planning to get into this field, your collaboration with other people is very important. Other mental health professionals is very important. So yeah, this is a setup. So what I am running, we are running a child development center, which is an interdisciplinary setup, and there is an NIOS section where children who cannot go to regular schools do National Institute of Open Schooling, and they do their 10th and 12th in open schooling section. The third part, so one is an early intervention section, one is an NIOS section, and the third part is a vocational unit. So 18 and above children with mental disorders who really cannot do even academics or functional skills, we train them for functional abilities, for vocational, pre-vocational. So this is the entire how the unit goes. Depending on the need of the child, where the child fits in, we rehabilitate them.
Practically what I understand is that if a parent has got a challenged child or a child with special requirements, this is the center where the child needs to be, or this is the kind of setup which requires for the child to, like you said, rehabilitate. Because all this while we were hearing about the word cure.
Correct.
But technically, in this case, it is rehabilitate.
Yes, absolutely.
Dr. Swapna, we are going to have one small segment at the end where we'll request you for a take-home message for all those who are listening to us over here. But before that, we would like to take up a Q&A session. And I request to begin with my question, because there is something that has really popped up in my head right now, especially in the subject of MD Homeopathy and Psychiatry. And those who are listening and who have done that specialty, tell us in the comments right now or maybe later on if you have also faced these challenges. The first challenge that comes up is when I mention MD Homeopathy Psychiatry in brackets on my letterhead, and if I give a fitness certificate. I personally remember a parent told me once that please remove that psychiatry from your campaign. Now, obviously, we know there are social stigmas, but coming to, the repercussion of that was that I did not know whether I should continue my specialized practice or, take up all sorts of cases. Because if you have done a specialty, you have done it for a reason so that you can practice it and, actually make a difference. How do we deal with these situations? Both ways.
Okay. So 2-3 things, Dr. Kayur, I understand what you're talking, and since as I mentioned, because we got an opportunity to intervene in the schools, this was something which had clicked me long time back. So when I started the practice, I was very clear about what is the type of cases and what is the segment population who would understand and need my degree. Okay, as you rightly mentioned, if I'm going to give a fitness certificate for coryza or allergic rhinitis, this could create a problem. But when I'm using my degree at the right place, the importance or the weightage of the degree is very, very important, and you get the right population. So maybe it takes a little bit of grit, patience, because right from the start, I did not intervene or did not take up any general cases with respect to even pediatrics. It was only later in time when everything was set up, I could then take up pediatric cases. But even that time, it was very clear that so as you rightly mentioning, if you are going to use your degree for the right, at the right place for the right thing, when you're suggesting maybe a testing or you're giving your impression, it is valid. It is even valid for schools. It is valid for other mental health professionals. They in fact call you for reference. So once they know you are in the field and you are able to help the child, I have seen no discrimination between saying that no, you are a homeopathic psychiatrist versus a psychiatrist. People come to you, people refer to you, people ask you to intervene, people want you to give advice to the parents, they want you to treat the child. So yes, and wonderfully, because homeopathy works excellent, and in pediatric cases, parents are very skeptical to start allopathic medicine, so they first approach a homeopathic doctor only. They want to treat, whenever the word medicines is used, they come to a homeopathic psychiatrist only. So this, if, as you rightly mentioned, when we use it, your degree is used at the right place, you are not only taken up to that level, you get the right type of people. Maybe a little bit of patience and courage is required, but it definitely happens. I have not had a difficulty where any time it was questioned that why you are doing it. So yes, I would definitely recommend people that if you are practicing or if you've got a degree for a particular thing, focus your practice there. Then maybe these challenges are not encountered.
that's quite the perspective on using the degree in the right place. That is something which is very fresh, and I am going to follow up on that. And the second thing, what Dr. Swapna said, is grit. Don't let go. You're holding on to that bar. If the minute you let go, you fall down. If you don't let go, you stay there. So yes, much needed. And so I would like to ask the audience, if you have any questions, please mention them in the comment section, as we are nearing the end of the podcast now. I think we'll have to wait for a minute, because it takes a little time for the, because there is a lag. It takes time for the comment to show up. So audience, questions please, if you have any, and we'll be happy to address them.
Yeah, feel free to communicate at any point. If any student or any practitioner has any doubt at any given point in time, please drop a message, please email, drop a message on the Instagram handle. Also, we'll be more than happy to clear your doubts or help you understand the way it has to be. Because I'm sure one podcast does not do justice to the amount of things. But if anybody wants to ask a question at any point in time, you all can definitely, we are available.
So don't worry, even if you're not a homeopath, if you're a parent who is listening to this, we'll be happy to have that as well. If you have any questions, please ask. And there is a request to all those who are listening to this podcast, please spread this everywhere with everyone whom you know, even if there is a child who requires special needs treatment, anyone, those who do not, because the awareness is important. You do not know the child next door, might be having that difficulty. And if you can just redirect that child to a specialist like Dr. Swapna, it will really help. So please spread this podcast everywhere. I understand maybe a lot of people may not have been able to attend this, but whenever you listen to this, please share this everywhere. So Dr. Swapna, there is one more question, which I think I'm going to ask you now is, parents drop out very easily. Yes. I'm not saying just from the special needs point of view, but even otherwise, parents, they tend to drop out. Someone, says that, nahi, idhar nahi, yahan pe jao, ye mat karo, aise karo. In the first place, how do you assess? Is there a possibility to know who will drop out? And if yes, and even otherwise, what do you do to ensure they continue in the program?
Okay. I will really share this personal experience. When I really started, I was so nascent in this entire field, and I had a child development center, Dr. Keyur. I was I wouldn't like to mention anybody's name, but very famous, very, very, very senior homeopathic homeopathic doctor in the vicinity in Mumbai who only treats autism. I used to have their children or cases coming for therapies, and I started my practice with only managing acutes, because either the line was too big, they cannot sit with a CP child for 88 hours most of the time, because the medicine is given the entire month, they are on placebo, so they cannot manage. You wouldn't understand the trauma the child and the parent goes if you do not see and ask the child to be on a placebo. I've seen cases converting into pneumonia. I have actually began my practice by managing acutes for these children, because yes, they were under treatment somewhere, they don't want to shift the doctor. I said, no problem. So this is what I actually started, and that is how I got into the entire, where the parents build up trust. Once your acute has been managed in acute, I have been able to help them out or to come for chronic treatment and go ahead. Doctor shopping is something which is very common, be it pediatric, be it any other. So the moment they tend to hear something, they definitely shift from one place to another, because that is what they feel it does good. 2-3 things. One, if everything is available to them, like if I have to go for shopping also, generally I may prefer to go to entire general store, which is like giving me all the things at one place. So then that helps for parents also. When everybody is under one roof, they know that they don't have to run to 5-6 places. So this is one plus point definitely in practice, because then they are with you for a longer period of time, because everything is available at one place, and that's quite a human psychology. Even if I have to pick up my bag and go, I will not go to buy something here and some grocery there and some grocery there. So that is one that definitely helps. So that is one point with them. And secondly, your rapport. As I told you, we are not here just to cure. So the moment you are going to sit with that in your head, that you are going to just sit and cure, and we are not going to manage them at the level of school. So when they see your effort that you are intervening with the school, they see your effort that you are trying to intervene with their therapist. When they see you actually doing the work, they hold on. So yes, we have kids from this small age to completing maybe their NIOS, as well as there has been cases of dropouts. So there is definitely going to be a mixed population which you have to work up, but you have to build, like, you have to know what you have to do. So then who is going to be with you will definitely hang around with you. Those who are really not going to be happy, especially till acceptance. I think in mental health awareness, till the word acceptance doesn't set in, they don't hang out. So why they are actually moving around is because you have told autism and they don't want to hear autism. So they keep on finding that person who will tell them that kuch nahi hai, So let us, I mean, that is what really we need to know, that this is again something that we have to build. We need to, mental health awareness is, the moment this awareness sets in, it becomes easier for you to hold on. So our more a job as a mental health professional, more than cure, is just awareness, awareness, and awareness. We do it, and awareness saves a life. That is all that I can say. So the more we do that and bring a change in the community, we will maybe see, maybe a few years down the line, this is easier. So what this challenge was earlier, I think now we are not facing that. This was definitely a challenge maybe some years back, but currently it is improving. Parents hang around till they really see that improvement. So yeah, that is what I think. For mental health, awareness is something that really saves lives.
Yeah, fantastic. So I mean, acceptance is a good indicator that we understand whether this, and then the second thing is to make sure that happens awareness. Right. We have a question from the audience. Dr. Vandana is asking how to handle cases in the rural part or remote areas where therapists are not available. How do we fill this gap?
Okay. So even when we did our MD, in a rural setting, yeah, these therapeutic alliances were not available. Dr. Vandana, one, maybe reading from your end to at least give, so a lot of units or a lot of our work is home programs, and we train parents, because yes, these therapies, let me tell you, it is not very easy and to avail, and they are expensive. So maybe continuing the entire thing for 3-6 months can be really heavy on pocket for any parent, and this would not be easy. So what we actually do, we do a lot of parent training programs. So maybe such training programs is where you can attend, you can learn, you can enhance your own knowledge about what bare, maybe you can't go to the core of it, but what bare minimal, if you need to know something about sensory integration, what are the things at home the parents and the child can do so that the child enhances his skill. Or you may not do remedial education, but you at least will know certain motor skill activities that you can tell the parents to do back home, which can help to improve the motor skills. So certain learning, certain training can be definitely done where you are trained and you ask them to do. You don't have to buy equipments for that. You don't have to buy things from the market. Everything जो आपके घर के setup में है, उसी की चीजें में हम बनाते हैं. In fact, Dr. Kate, now that this question has come up, with Pratham runs OBE levels for NIOS. We have done videos for parents in slum areas and those, where we have set up right from management of epilepsy to management of an ADHD child. We've created videos with what things you have had home, how you can help the child. What is the first basic, like just some first aid कहते हैं ना, what is the first line of treatment that you can do? That is, even, I mean, there are so many videos which are also there. Therapists, the doctors can learn from them. And secondly, I think another very important thing is reference. You should know at what point you need to refer the child. You cannot, like, even there are stages when I say, I think you need to take an opinion and you need to come back, or you need to maybe intervene with, pharmacological intervention. Now it is a stage that this needs to come up. So yes, I think reference is another thing where maybe you have to send the parent to some place like a metropolitan place or the nearest thing, get the training, come back, and then implement. Take proper follow-ups. They do it once and they leave it. So again, your job comes here, whether they are following it up. You can call up the therapist, take the program and train your parents. So again, this takes effort from your point. So provided you know what you are doing and you are willing to do it, there is a way out. You may be any part of the world. We have parents and patients from the US, they come from UAE, they are not with us. Online nowadays, things have become very easy. So you can definitely consult somebody through through internet and through social media, and you try to help them. You get your understanding and then you train your parent, or you ask the parent to just consult somebody online and get it done. So nowadays, I think the distance gap, rural, semi-rural, has really changed. We have people even coming from the interiors through online. We have mails, we communicate with them, send them videos of different children, how things have to be done. They send their videos back. So life is currently been easier, and I think the 2 years of pandemic has brought a drift change where everything is now, being done through online platform. I think people should take an opportunity of this and connect with the right people. So yes, references should be done appropriately and collaboration has to be done appropriately. I think that is how you can help your patient. If you want to really, really, you're looking at something beyond cure or beyond giving medications.
Wow. So, Dr. Vandana, I hope that answers your query and you will start something at the place where you are living in. And I'm sure once you do that, you will be able to make a difference in the people around you. Okay, so Dr. Swapna, no more questions in the comment section. And I would now like to ask you for a take-home message for students, interns, early practitioner, as well as experienced practitioner. But also, with this, a message for the parents who might be listening to this.
Okay. Okay, so we have 5 people to be addressed. So yes, it goes different for different populations. So I'm sure for students, they all colleges will give you dream high, dream big, follow your goals, pursue what you have to do. I think one message which has brought me here since the time I'm a student, which you can cross check with any of the faculty. I think the word is drive. You need to have a drive. You need to be crazy to have the drive. You need to have the courage to have the drive. And if you are driven towards what you want to do, I think no dream is big that you cannot achieve. You will move towards it. Yeah, there are challenges every single minute, but if the drive is there, that every single morning we wake up with the same enthusiasm to go to your clinic or your center or your work with the same amount of energy and drive to see what new you can do to the world today, what new you are going to bring about a change in somebody's life. One social smile that we get after intervening, and that's our victory. One sound is a victory. So the victory in your challenges that you create for yourself. So a drive is important. Rest, everything can be managed. So that is my simple take back. Second thing which I learned myself was after writing up the research paper. So students and practitioners, we need to read a lot with respect to what people have written. So nowadays, even if I want to, I go to ResearchGate, I will see what, and the thing is there. The best part, even if it strikes your mind, there is a paper on it written by someone somewhere, not just homeopathy, but even with respect to psychology, psychiatry. And then you believe and you say, oh, wow, it does exist. And this is what I was thinking, but it does exist. Somebody has also thought about it. So writing papers, reviewing, reading journals, subscribing to them, again, is very, very important. Just has given me a wonderful platform to put across to people. And I think, yes, reading that will definitely help. Peer review journals are very, very useful. So yes, that is again what I would like to give the audience a take back. With respect to practitioners, with respect to senior therapists or whoever, doctors, I think we need to, we need to come out of the box. We have to start collaborating. And we need to really, really need to learn from many other people. We cannot just sit in one place and say, I am curing or I am treating. The entire, as I mentioned, we have a role. We have a role in rehabilitation. And we need to develop an entire collaborative system for the patient. So yes, for practitioners, please, we should start. I mean, that is one tip, one advice, one personal experience I would like to share, that collaboration does help. When you are amongst them, it becomes very easier for the parent and the child to, or any other illness, I could say, to facilitate the process. It becomes very easier. And yes, for parents, anybody having mental health conditions, mental health problems, I think awareness and acceptance. So the world, what I do, I don't cure, I don't treat. I am only facilitating inclusion. From what I'm doing from last 15 years is just the word inclusion. We are just trying to include as many people having the difficulties amongst the normal population. So inclusion is something that everybody is striving for. If you are aware that it needs to be done, it will happen. So you need to not give up at any process, at any stage. No effort is wasted. No effort goes via, I've spent so many years with my child, but there is no use. No, there is always there is something that will come out of it. So awareness, acceptance, and inclusion. I think I will give these three words back for the podcast today. That a lot can be done in the field of mental health only by these three words. If we are sensitive enough to anybody, anywhere on the planet, I think it just takes away. Then the person himself gets the grit to help himself. So yes, this is something which I would like to take back, even on my platform, even on MLDMHI. Spread as much as, be sensitive enough and spread mental health awareness. You are able to save a life. We are not here for any emergency medicine, but just your kind words or empathy or acceptance. What we are trying to do today in the community is that we accept and we are able to include you. So the moment you bring about that change, life is simple. The planet is a better place to live in for everybody. So that is just my take back for it.
Madam, for parents?
Parents, again, yes. Where parents actually struggle is not with respect to intervention, but is with respect to acceptance. Again, that is the thing, that till everybody, because as I said, everybody in the family has to be accepted. बच्चा 4 साल का है पर speech नहीं है. हमारे अब्बू और हमारे somebody in the family were also late speakers, so they are waiting and they are waiting. So they are not trying to understand the developmental gap that has bridged. If I have to start this, or my therapist has to start speech therapy at 5 years or 4 years, and which the milestone has to be achieved at 18 months, the gap is huge. The gap is huge. So please understand the red flags. At least go and get a consultation. You needn't start. They fear that the moment they come to a doctor, you will be labeled and diagnosed. This is even what happens in school. So we are not here for labeling or diagnosing. You understand how you have to help your child. We don't wait for a simple coryza to go into fever or bronchitis. हम उस level पे भी जब intervene करते हैं, then why not ignore? Why ignore the red flags? If the child is showing reversals, you should know. नहीं वो उसका बड़ा भाई भी उल्टा लिखता था, तो हम ये भी उल्टा लिखता है. No, don't ignore the red flags. Everybody is well read, everybody is aware, but we are not able to come out of that belief that, oh, I may need help. So this is, I would give a take back for parents, that don't ignore the red flags. Visit, at least consult, take home programs, try to work on the child. See that you can help the child, facilitate the process, and then yes, if you feel it's still not happening, then you can seek professional advice. So don't hesitate to seek professional advice with the fear of being labeled or tagged. No, I don't think we are here to label or tag anybody. We are only here to help you to facilitate the growth and development of your child. So this could be a take back for the parents. Parents, please understand that awareness, acceptance is the key to help your child. So yes, don't ignore the red flags. I would just like to mention that.
Agreed. And that example which you gave was quite interesting and relatable, that we do not ignore a cold. We go to the doctor, then why ignore the signs which are actually going to have a very long-term impact on the child later on. So yes, dear audience, do share with us in the comments now also and later on when the podcast is posted as to how did you like it, what are your reviews, and what more you would like to know. For any query specialized to this subject, please DM Dr. Swapna on her handle. And we'll also leave an email ID for Ira Gurukul in the description section where you can reach out to them should you require any expertise from them. And do follow us on the MLDMHI podcast. We try to get the best speakers, the speakers who have achieved a lot and they are specialists in their own field. So do attend and do tell others also about this podcast. And so we'll meet once again next Sunday with yet another speaker. Until then, thank you, Dr. Swapna, for your valuable time, your guidance, for all of us who are listening over here. Personally, I will say I was enlightened today to a great extent, and I will try my best to spread the knowledge that I've learned, I've gathered today, and I will also request others to do the same. Thank you, everyone. Thank you, Dr. Swapna,
Thank you.
for this wonderful session.
Thank you.
All right.